New at 11, medical experts say the number of assaults on healthcare workers are going up. Now, the South Carolina Hospital Association is seeking solutions for the abuse many employees unfortunately face. WCNC Charlotte's Julia Kaufman tells us about their new statewide reporting system.
5,217 nurses were assaulted from April 1st to June 30th this year. That's 2 nurses being assaulted every hour, according to a national survey of 483 healthcare facilities.
We've all been punched, kicked, spit. I've had a lanyard pull around my neck where someone tried to grab me.
Kelly Bouthillet is president of the South Carolina Nurses Association. She says all types of care centers are seeing an increase in violence since the start of the pandemic. The South Carolina Hospital Association says 44% of nurses reported experiencing workplace violence, and 68% reported experiencing verbal abuse during the pandemic.
It is very unnerving, and it is causing people to leave the profession because the employers either can't or aren't addressing it enough.
That's why SCHA has created a new reporting system that will help gather more accurate, up-to-date information on how often and where hospital violence is happening.
The verbal assaults, the punches, the scratching, the throwing items across the room. We want to be able to track all of those. And right now there is no entity that collects that data. And that's what we're trying to do with this project here.
Laura Hewitt with SCHA says they'll pull data twice a year to analyze it, working with hospitals to implement better protection and prevention measures.
We really do hope it will kind of springboard to a lot of best practices and a lot of enhanced, hopefully, communication and coordination with law enforcement partners.
Bouthillet says she hopes the data will lead to the standardization of assault reporting procedures. Both SCNA and SCHA are pushing for federal legislation that would increase penalties for assaulting a healthcare worker. In Charlotte, Julia Kaufman, WCNC Charlotte.
There have been efforts on the state level in the South Carolina General Assembly to pass protections for healthcare workers, but the bills have failed each time.